I'm Lorinda Bullock, and this is Elsevier Global Medical News. I'm here in Washington, D.C. at the 2008 ASCO Breast Cancer Symposium. And I'm joined today with Grace Smith of the MD Anderson Cancer Center in Houston, Texas. Thanks so much, Dr. Smith, for joining us today.
Thank you for having me.
Dr. Smith, could you explain to us just how wide the gap is?
Sure. So our study found actually a significant disparity in the treatment of breast cancer between Black women and white women. And what we found was, in fact, a 9% absolute difference in radiation rates after lumpectomy, with Black women being treated with radiation about 65% of the time on average throughout the country, compared with 74% of the time for white women. And this magnitude of disparity was actually very concerning.
The gaps appear to be largest in the South compared to other regions. Did you factor in the fact that more Black women on Medicare may live in the South compared to other regions? And did that affect your results?
Well, I think that the reasons underlying the racial disparities, number one, are probably complex and multifactorial and not necessarily able to be found through the data that we have available through our study. However, I think we can speculate, and I think there are probably multiple factors that contribute. Perhaps there are certain patient conceptions about the value or role of radiation after lumpectomy that need to be improved or corrected, and perhaps physicians in certain areas of the countries have certain practice patterns or even biases that need to be addressed. However, the factors that you mentioned, certain socioeconomic factors, access to care, certainly could play a part. And this indeed may play a role, perhaps in different ways in different areas of the country. For example, if there are particular urban populations or rural populations in certain areas of the country.
And so now that we have this research, what can doctors do in their personal practices to help combat these gaps and fight the barriers that you just mentioned?
Absolutely. I think the value of our study, I hope what health providers can take away from this is just on a basic level an awareness of the disparities. I think if physicians, for example, are aware of these disparities, then they can be better equipped to facilitate the care for their patients. For example, if a patient on first glance may appear non-compliant with their radiation, perhaps with better communication and awareness, they may be able to elicit specific obstacles or barriers that their patient is facing, and they in fact can be in a position of influence to facilitate overcoming these barriers for their own patients and hopefully be able to increase the quality of care for their patients.
Well, thank you so much, Dr. Smith. We really appreciate you speaking with us today.
Thank you so much.